Good morning, everybody. Thank you for joining us. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take a moment to click buttons to make sure that all of the media have permission to record. You'll have permission to record, and we're also recording this briefing and we'll share on the Health District's YouTube channel and website today. So give me just a moment. Okay, I think I've given everybody permission to record, but if you have any issues, please send a message in the chat box to the Joint Information Center and I'll get that fixed. We're joined this morning by Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Spitters. Each of our speakers will be sharing an update, and after they've commented, we will take questions using the chat feature. Please make sure that you submit your questions to everyone so that all of our speakers can see. Thank you again for joining us. And with that, I will turn it over to Executive Summers.
Well, thank you, Heather. Good morning, everybody. Thanks for joining us. So today I'd like to spend a little time providing an overview of our American Rescue Plan Act spending proposal that the Snohomish County Council approved last week. So these funds are going to be used for Snohomish County's ongoing response and recovery work related to the COVID-19 pandemic. As you probably know, federal legislation provided grant dollars directly to counties, and Snohomish County received just under $80 million in May of this year, and we expect to receive the same amount in May of 2022, so total $160 million. The funding proposal approved by the County Council is really going to go towards many of our most critical needs, including health, childcare, housing, economic development, food security, and behavioral health programs. And I'll provide now a quick overview of some of these high priority areas. So we're going to provide $10 million in additional support for the Snohomish Health District to respond to COVID-19 through vaccinations, contact tracing, and testing. We also know that the lack of childcare will continue to slow economic recovery. So there's a lot of workers who are trying to balance earning a living and taking care of their children. So we're going to be establishing a couple of programs to help with these needs. We're going to be proposing to set up a parent choice voucher program for individuals who first want to work but can't afford childcare, or are low wage earners performing essential work will need to stop working due to the need to make changes in childcare arrangements and are unable to pay for those changes. So folks that want to work but can't afford childcare, or essential workers. We'll also address two other needs associated with childcare. First, funds would be set aside for one-time grants for childcare providers to start, stabilize, or expand their childcare businesses to meet the needs of families who are really furthest from opportunity, so assisting childcare providers. And the second is a workforce retention strategy through the purchase of group classes for existing childcare workers so they can obtain the new certification needed to continue in their field. So providing training and support for workers to get certified. Another area of food security has been an ongoing priority during the pandemic. We're going to spend an additional $500,000 on our Nourishing Neighborhoods program, providing food security to some of our most at-risk families in Snohomish County. We've been doing this program this last year, but it also leverages locally grown produce to the greatest extent possible, supporting the local agricultural industry while feeding those in the most need. So we're proud, and that program has been working well, and we'll continue that. We also know that providing more behavioral health services in the county is essential for reducing suffering and maintaining our quality of life. So we are planning on spending $2.5 million to support a collaborative strategy with participating cities to address behavioral health needs, and we are meeting with the cities and the mayors to work on these programs. It was identified by many of our cities in the county as a top priority for them. Another critical need is housing. We're going to be spending $6 million to fund a countywide sheltering effort, while offering other services to support stability and long-term resiliency of the individuals served. So it's not only housing, but it's other assistance that they need to make sure that they're stabilized and can stay in housing. Our current formal shelter network in the county has approximately 700 beds, more than 600 year-round, and approximately 100 cold weather beds, so a total of over 700. Over the past few years and during the pandemic, we've seen a greater demand for more nights over more months for sheltering. So we anticipate the number of days for which sheltering is needed will continue to grow, particularly since individuals experiencing housing insecurity and homelessness have been disproportionately impacted by the pandemic. We're also going to be establishing the Carnegie Employment Support Services Center. Community partners will provide one-stop services at the Carnegie Employment Support Services Center in the Carnegie Library there in Everett. This center will ensure a family-friendly approach for low-income households who have suffered negative economic impacts from the COVID-19 pandemic. Households will receive assistance in labor force entry, re-entry opportunities, with the real goal of increased economic and housing stability for those families. We have a number of other vital programs we will be supporting, including resources for seniors, BIPOC-led organizations, business and workforce efforts, supporting our ports and public facility districts, working on increasing broadband access throughout the county, economic resiliency, and our food and farming center. So all of these investments really are going to help those in need and are intended to and focused on them, ensure that we're doing all we can to help our community recover from the pandemic. A lot of businesses, families, and individuals have suffered through this, and we've got a lot of work to do to recover and gain some stability in our communities. So I really appreciate the partnership with the County Council as we navigate opportunities and challenges in front of us. Many thanks to them for their support. And with that, I'll hand it off to Snohomish Health District Officer, Dr. Chris Vitters. Thank you.
All right. Thank you, Executive Summers, and additional thanks for obviously those resources that are so critical to the health district's efforts to address the pandemic and all the wraparound community-wide services that you just listed. Just a phenomenal response, and thank goodness for that help. Good morning, everyone. Just take you through our usual list of information, starting out with our weekly case count and rate update. So the 1 week case count ending Saturday, October 9, had come down to 1,383 cases for that week, down from about 1,650 cases the prior week, and about 2,200 cases per week at the top of this current wave number 5. The 14-day case rate ending October 9 had also come down to 357 per 100,000, down from about 400. It's good to remember that we're still in a high transmission category. Anything above 200 is categorized by CDC as high transmission. So the trajectory is great. Let's hope it's sustained. Let's all do everything we can to continue it, but to also keep in mind that we're still at a very high level of transmission, and that all of the common sense prevention measures, especially masking and social distancing, are still indicated. We're still seeing about 15 to 20,000 tests being done per week, but the positivity rate has dropped from the low teens down to around 10%. We don't have perfect visibility on that because there's a large backlog of negative tests that haven't been uploaded into the state system, but from our own testing and from some of the healthcare partners' testing, I think it's safe to say that the countywide positivity rate is right around 10%. In the healthcare system, while the reduction in COVID cases in the hospital is a welcome relief, the system is still under siege due to high census counts in the hospital. You may recall that a couple of weeks ago, we peaked at around 105, 110 COVID beds countywide being occupied by, 110 hospital beds being occupied by COVID patients, roughly just under 15% of total beds in the county. That's come down to 62, so about a 1/3 drop. Again, that's very welcome, less than 10% of the roughly 700 hospital beds in the county. But let's remember that most of the current hospital surge is not due to COVID. COVID was an add-on to that. And so the ongoing staffing shortages in acute and long-term care persist, and our healthcare system remains really struggling and working hard to provide all the acute care that's needed. I want to mention that this last week, you may recall, we wanted to remind everyone that we were transitioning the Outweigh Park and Ride to be a dual function site with vaccinations 2 days per week. With testing 2 days per vaccination 2 days per week and testing 3 days a week. The site will be closed to the public on Wednesday morning, that's tomorrow, October 13, for staff training and final setup, but will be open for appointments in the afternoon. Moving forward, it will be a vaccination-only site at Outweigh there on Wednesdays and Thursdays from 9 a.m. to 4 p.m. Then the site will be testing only on Fridays, Saturdays, and Sundays for the same hours, 9 a.m. to 4 p.m. The main vaccine product being offered will be Pfizer, but Moderna and J&J will be available as supplies allow. Again, this is by appointment only. At this time, you can call 425-339-5278, 8:30 a.m. to 4:30 p.m. to make an appointment. Our preference, though, is before making a call, if you're able to, go online and try to register that way at our snohd.org/COVID vaccine, all one word, to register. And first, second, and third, and booster doses will be available, keeping in mind that the booster doses are limited right now to people who got Pfizer for their first 2 doses, who are more than 6 months after their second dose, and who are either over age 65 or, if under age 65, have an underlying medical condition or are employed in a high-risk category that makes them at elevated risk. Stated differently, folks under 65 who don't have underlying medical conditions and are not employed in a high-risk occupation are not currently eligible for a booster. Proof of vaccination and eligibility is required if getting a booster. Bring your vaccine card or your MyIR, that's my immunization record, printout, or bring it on your phone. We're getting very close to being able to announce another location soon. Stay tuned for more on this later this or next week. Other reminders and updates: the Food and Drug Administration's Advisory Committee on vaccines and related biological products has upcoming meetings later this week to address expansion of the emergency use authorization of Moderna and Johnson & Johnson boosters as requested by their manufacturers. So if that extension of the EUA were granted by the Food and Drug Administration, then we would expect a meeting by CDC's advisory committee in the next week or so to provide clinical recommendations upon which we all in public health and the healthcare system would act to implement those recommendations. So stay tuned there. And also know that the Food and Drug Administration and CDC's advisory committee also have scheduled meetings later this month to begin discussion on extending the emergency use authorization for vaccination down to 5-year-olds to cover the 5 to 11-year-old gap that currently exists. Again, it's, we just got to stay tuned and see what comes out of that process, but it's certainly conceivable that we'll have vaccines recommended and available for that age range at some point in the coming month. Meaning probably November. New on the news front, molnupiravir, that's spelled MOLNUPIRAVIR. Molnupiravir is the first oral direct-acting antiviral shown in early phase 2 trials. Those are trials aimed at finding the right dose and checking on safety. Found to be effective at reducing carriage of the COVID virus in the nasal cavity, and it had a favorable safety and tolerability profile in those phase 2 studies. Then the phase 3 studies began several months ago. That's looking at larger, thousands of people, targeting mild to moderate, non-hospitalized COVID patients to look at the impact on subsequent hospitalization. And in the manufacturer reports that hospitalization rates in those individuals was decreased from 14% in the group that got placebo or no treatment to 7% in those who received a 5-day course of the molnupiravir. Merck has submitted an application for emergency use authorization to the FDA based on these findings, and plans to submit marketing applications to other regulatory bodies worldwide. Overall, this is good news of progress on the therapeutics front, addressing the pandemic. As you can see, a 50% reduction in a highly focused group of mild to moderate cases in the outpatient setting. That's good news. That's almost as good as, say, the monoclonal antibodies do. They reduce subsequent hospitalization in high-risk individuals by similar order of magnitude, a little higher, about 70%. So it's another tool that could help us prevent hospitalizations. Apparently, some clinical trials looking at folks with more severe, further along in a bad course of COVID, it may not be so helpful. But again, another tool. Let's see how FDA handles this and what recommendations come forth for its use and following that. So that's really all the news that I've got today. And with that, I'll turn it back to Executive Summers.
Great, thank you. So we've got one question in chat. Dr. Spitters, do you think a vaccine mandate for county workers would help increase your rates? We've seen rates go up in King County, so I was curious if you thought this would be effective and if it's being considered in Snohomish County. And I'll address that too also when you're done, Doctor.
Yes. I've lost visibility of my Zoom screen. Can you hear me, Executive Summers?
Yes.
You can. Okay, yeah. Well, certainly mandates have their place, and they're also not without risk, benefits, and alternatives. So I think overall, as long as mandates are applied fairly, and don't have significant unintended consequences that hurt us in some other area, or that paradoxically produce a disincentive to getting vaccinated, I think that they're generally a good idea. In this specific instance, we are, the health district is a municipal corporation with overlapping governance with the county, but we're not a county agency, so I really defer to the county leadership on whether that's an appropriate response for county employees.
Yeah, and just a couple of things. We are already over 70% vaccination rate with county employees, according to the numbers we have. We will fall under the president's mandate. We are an organization over 100 employees, so we have been waiting for a number of weeks now for direction and rules from OSHA and state L&I about how that program will work. And so we will shortly have a mandate in the county coming down consistent with the federal rules when we get them. So I think that will help encourage others. And we have a number of employees that are healthcare workers and related types of things that fall under the state mandate also, and we're processing those and There's some exemption process for religious reasons, and we're working through those. Smaller group, but again, when the federal rules come down, it'll affect our entire county employee base. Let's see. Follow-up question on that one. Do you think the benefits of a mandate outweigh the risks, or would it make things worse, Doctor?
Oh, I think, in terms of the medical and public health impact, in general, it ought to help. It's the risks are more, related to, I think the healthcare system has had to deal with this a little bit with the impending maturation of the state requirement that by October 18, all healthcare providers and other staff in healthcare settings be fully vaccinated. And some unspecified small minority of workers might choose to work elsewhere, exacerbating staffing shortages. I think that's the chief risk, but I think it's also the right thing to do. I support the general idea, and the health district currently requires its covered staff under the state mandate to be vaccinated, and likewise when the federal requirement for employers over 100, which we are one of those, comes, we will harmonize with that.
Okay, Doctor, I think this is for you. Do you expect a rush on vaccines again once they're opened up for younger children? Is that part of the reason behind the work on your upcoming new location?
Right. So yes, I think I do expect that. Certainly the way it rolled out with the older kids was that there was a rapid uptake over the course of 4 to 6 weeks, and then it kind of stalled out where it's at now, with about 60% or so of 12 to 17-year-olds being covered. I expect a similar flow because it's really largely parent driven, especially with the younger kids. So those who are interested in their children being vaccinated, I think we'll see them looking and showing up early at their healthcare provider, pharmacies, and then of course we're working with the school community to make sure that there's a safety net for those kids who can't get vaccinated through typical community-based venues like healthcare systems or pharmacies.
Again, for Dr. Spitters, from the vaccination data during October 1st, 2nd, 3rd, 4th, was there a larger than usual increase in people initiating vaccinations for the Johnson & Johnson vaccine in order to meet the October 18th proof of vaccination deadline for certain employment sectors?
We don't have visibility on that by product at the county level. So we just see total doses administered, and then there's a back calculation that we can do to estimate dose 1 and dose 2. Again, Johnson & Johnson is a small minority of vaccine supply in the county, so I can't affirm what you're saying. I've certainly heard that notion mentioned, and I've heard specific anecdotes of people who didn't, want to deal with 2 shots. Johnson & Johnson provides a reasonable option for them, and that's great, but I can't enumerate it for you. Sorry. I will say we have seen an uptick in overall vaccinations. We're running 10,000 a week for about 6 or 8 weeks, and then last week it bumped up to about 13,000. So not a huge bump, but a bump nonetheless, and with a lot of new first doses being administered, more total doses and more first doses administered. That I think it was actually the last week of September is the one that we have total numbers for, but more than since mid-June. So hopefully that's a sustained trend.
The CDC announced last week that over 140,000 children in the country were orphaned throughout the pandemic. Are there numbers in Snohomish County you can share when it comes to children who have lost primary, secondary caregivers? If so, where are they now? I don't have any information on that.
No, I would suspect that the State Department of Children, Family, and Youth would be the shepherd in essence of those kids until or unless family members or someone has gotten involved with them. But we're not directly in that line of activity, and I don't have data for you on that.
Just I'll inquire with our folks in Human Services and see if we have that information or know where to get it if it's available. Okay, any other questions?
All right, last call. All right, we'll go ahead and wrap up for today. Thank you all for joining us, and please stay tuned for future media availabilities. Have a great day.